In this video, I'm going to talk about the rehab to do right after having a total shoulder replacement. Hi everyone, welcome back to the channel. In this video, I'm going to go through the exercises I give my patients who are in the immediate post-op stage after they've had an anatomical shoulder replacement. So to back up a little bit, there are two types of shoulder replacement, anatomical and reverse. So those that get the anatomical shoulder replacement get that because they have bad arthritis in their shoulder, but they have an intact rotator cuff, and we're going to need that later in recovery. While those that get the reverse get that specifically because they have such a bad rotator cuff tear, it's beyond repair. And the rehab for each of these is a little bit different, and the immediate post-op movement restrictions are a little bit different. So in this video, I'll go through the exercises that we start with right after surgery, and at the end of the video, I'll go through the movement restrictions that you gotta obey during this first 4 to 6 weeks after surgery. Before I demonstrate the program, I wanna remind everybody, click those like buttons, subscribe, leave a comment, let me know how you're doing after your shoulder replacement. So we can't forget about the end of the arm, the elbow, wrist, hand, which will get stiff and weak while you're in that sling for about 4 weeks. So first off, grip strengthening. Tennis ball works great, racquetball, any of the grip strengthening devices are fine. Simply squeeze, hold 5 seconds, relax. And just do this repeatedly, 20, 25 times, 4 or 5 times a day. You can do this with your sling on or off. That's one thing you can take your sling off for, is doing your exercises. So again, squeeze, hold 5 seconds, relax. And again, you'd be surprised how much grip strength you'll lose while you can't use this arm. Next, elbow range of motion. Simply bend all the way, that's the important part, get all the way to end range, straighten all the way, up and down. Again, it seems very simple, but the elbow will get surprisingly stiff while you're in that sling all the time. Do about 20, 25 reps, again, 4 or 5 times a day. Next, pendulum exercises. Now, not only does this help with range of motion of the shoulder, help maintain range of motion of the shoulder, but it is surprisingly effective at decreasing pain. So let the hurt arm simply hang down while you're leaning on something. You're leaning on a chair, you're leaning on a countertop, a table, and first, focus on letting the arm relax, which is harder than you might imagine when it's painful. Let it relax. Once you feel like the arm is relaxed, simply shift your weight from one foot to the next, and the arm will gently swing with your body's momentum. Now notice the difference between what I'm doing here, the arm swinging with my momentum, versus this. We don't want this. This is the arm producing all the movement. Not right. We just want the arm relaxed and swinging. So do this for about 30 seconds to a minute, again, 4 to 5 times a day. Next, we're going to work on some of the shoulder blade muscles, which again get really weak while you're immobilized in your sling over a prolonged time. So here's what you do. You're simply sitting up. First rule, you got to be up tall. Okay, make yourself as tall as you can. You'll be in your sling for this one, and you simply try to pull the shoulder blades down and in. I sometimes say to patients, imagine like you're sitting or standing like a Marine. Hold this for about 5 seconds, relax. So it doesn't look like much movement. It's surprisingly tiring. Down and back with the shoulder blades, hold 5 seconds. Again, 20, 25 times, 4 to 5 times per day. Next, we're working on mid-back mobility. The point of this is we need our mid-back, our upper back, to have a little flexibility for our shoulder to reach to a normal degree. And being in that sling all day tends to make our mid-back pretty stiff, so this exercise actually helps mitigate pain pretty well. So a rolled up towel behind my back. Again, you'll probably have your sling on, and you simply lean back, looking up, hold 10 to 15 seconds, relax, and do this 3 to 5 times. Lean back, hold, let the mid-back stretch, 10 to 15 seconds, relax. Last exercise, we're actually going to move the shoulder. So in this example, my hurt arm is my left arm. I'm going to use my stability ball, and I'll explain a non-stability ball version at the end in just a second. So hand is resting on the ball. Important, there's no weight on my hand. Okay, I'm not pushing through my hand. My weight is on my opposite hand through my knee, and I'm simply going to lean forward. Now another important point, we're not moving past about a 90-degree angle between my arm and my spine. This is about our max reach at this point. Okay, keep it gentle. Hold this for just a few seconds. Come back to upright. Reach out. Again, no more than about 90 degrees at the shoulder. approximately that position, hold for a few seconds, come back. Now, if you don't have a stability ball, you simply sit at the table, have a pillowcase on the table, hand on top of the pillowcase, and you simply lean forward at the waist until, again, you get to approximately a 90-degree angle between your arm and your spine, hold for a bit, slide back to upright. Do this about 20 times, and again, as with the other exercises, 4 to 5 times a day. At the beginning of the video, I talked about movement restrictions that we have to abide by after undergoing a total shoulder replacement. And the point of these restrictions is to simply protect the tissue that had to be cut through to get the new parts into the shoulder. So first off, sling use. Pretty much 24/7 for the first 4 to 6 weeks. That time frame varies a bit from surgeon to surgeon and patient to patient, but that's pretty typical. 4 to 6 weeks, 24/7 sling use. The only time you're out of your sling, when you're in physical therapy, when you're doing your home exercises, getting dressed, showering. That's it. Next, no reaching. You can't reach with that hurt arm until you're somewhere, again, around 4 to 6 weeks post-op. Also, no lifting or carrying anything with the hurt side. And last, no bearing weight through the arm. So for example, reaching out to push a heavy door, bearing weight as you lean on a countertop. Big no-no. So again, restrictions: 24/7 sling use, no reaching, no carrying, no bearing weight through the hurt arm. Those are the exercises and movement restrictions for the person who's had an anatomical shoulder replacement, and they're in that first 4 to 6 weeks after surgery stage of recovery. I hope you found this video helpful. I hope it helps you get back to what you love to do. Again, like, subscribe, leave a comment, let me know how you're doing after your shoulder replacement, and we'll see you in the next video.